Hello, I'm Dr. P.J. Mazumdar from Arogyam Hair Transplant Clinic. So today we are going to discuss about beard transplant, beard and mustache transplant. So usually both occur together. So this is a very common form of transplant. Next to hair transplant, we do the maximum number of cases of beard and mustache transplant. So today I'll discuss in short the entire process, the results, etc. and everything that you need to know about this. So what we do in beard transplant is we put the permanent hairs from the scalp into the areas which are deficient of hair in the face. So usually we will do it in people who do not have the desired amount of beard or the desired amount of mustache. So we plan out the area, then we make the slits, and then we take hairs from this permanent zone. So the permanent zone contains hairs which will last lifetime. So we take out these hairs one by one along with the root, and then we plant it into the facial areas, and there it will grow lifelong. So it looks just like a natural beard. There is no difference. The beard can be shaven, it can be cut, it can be colored, and it can be shaped in exactly the same way as a normal beard can be done. So the shape of the beard, so that can be decided by the patient and by the doctor. So we discuss thoroughly with the patient as to what needs to be done, as to what amount of beard that he needs. So generally the most often what we do is this French type of beard. So people who do not have the beard here and maybe only a few hairs in the mustache area, so we plant in the mustache area, we make it through here, we draw it here and then around this part. So that will take about 3000 grafts. So that is the most common area that we do. Sometimes people do have a lot of hair but it is deficient in some areas. So in that case we just cover up those areas. So in that case lesser amount of grafts will be needed. So in that way this is partly by the patient's choice and partly by our choice also. We discuss thoroughly with the patient and accordingly we do the whole thing. So the number of grafts, that will depend on how we have drawn the area. So if you are going for a big transplant, we extend up till here, and the patient also has very little of his own hairs in the beard area, in the mustache area, then the case becomes larger. A larger amount of grafts will be needed, say 3000 to 3500 grafts. But most commonly we can usually finish this within 1500 to 2000 grafts. So all that we take from here and we plant here.